So hi friends, I am Dr. Anshul Bansal joining you on this Unacademy platform. In today's YouTube live session, we'll study about INICET based MCQs, INICET previous years MCQs, AIMS MCQs of the last years, as well as I've added some newer potential MCQs. So we'll have a focused INICET session in today's YouTube class, and we'll study the theory part of the questions also in a brief so that you could revise your subject as well. Because every time I've told you that question practice is the best way to revise. Don't be afraid of doing questions or giving the test. They are the best way to revise because question practice mein you'll revise the things that are super important. Okay, so as you all know, I am here to guide you for the subject of orthopedics, and we'll study in-depth orthopedics here so that you can crack not only your NEET PG INICET like competitive examinations, but you can also build up your concepts about the subjects and also do well in your professional or university examination also. Okay, we will have special focus on the clinical based questions, the clinical scenarios, x-ray images, etc., so that you can betterly understand the topic, and also you can do well in your next type of examination or your newer NEET PG pattern. Okay, so let's start today's lecture, and before starting today's lecture, I will just briefly guide you through our various subscription plans that are available on Unacademy for the NEET PG. Okay, so the first one is a plus subscription. The plus subscribers will get access to all our live and recorded classes, the entire QBank, and they can participate in live tests and quizzes, all of which is formed by the topmost faculty for NEET PG in India. And also we will allow the subscribers to log in into the different devices with the same account so that they can study on any device of their choice at any time. And also for the subscribers who will be subscribing for 12 months or more, we will be shortly providing them with a printed notes. You can use this code while subscribing to get extra 10% off. Okay, the second one is our iconic subscription. Iconic subscription is the best subscription not only on the Unacademy platform but on any digital platform for NEET PG across India. And what makes it best is that apart from the things that I've told you earlier, in extra May you will get the prep ladder and all of the prep ladder, including its entire QBank, the video lectures, the rapid revision courses, the tests, grand test, etc., everything. And on Unacademy में extra में you will get well structured live classes which are batch wise classes, and we have formulated a course and the batches in such a way so as to build your basic concept about any subject or topic first, then going into its in-depth. And also we try to correlate the same topic in different subjects so that you better understand that subject, and also you can revise and correlate कि yes ये same चीज मैंने वहां पर भी पढ़ी थी. And also the iconic subscribers will get an individual test assessment after every test that they give so that they can analyze themselves कि yes this topic or subject needs more practice or more study from my side, और इस subject में से this topic में has the more weightage और किस type के questions आते हैं. So it is very important to plan your journey or the preparation for any competitive examinations, and these tests helps you a lot. So proper analysis and assessment is very important. So the iconic subscribers will get all this, and you can subscribe for the iconic subscription, and while subscribing you can use this code to get additional 10% off. Special classes are very important as well as special important because they give you extra edge over your competitors, and they are very special because they are live interactive classes, and also in this COVID times also they will give you live classroom like feeling where you can interact with the educators, clear your doubts. You can just raise your hand and ask your queries, participate in the polls, watch it anywhere anytime just by logging into your mobile application. And also you can have the digitalized notes of that class. For this you just need to download the mobile application and log in using this code, both of which are absolutely free. Okay, so special class, I always say they are the must attend class, very important. Okay, now we are having a uh, cons a special thing that is on 10th November 11 a.m., which is NEET PG Combat, in which in 60 minutes you have to solve the 45 questions, and out of the ranking we are giving a handsome scholarship for our NEET PG students. Okay, so it is a very good contest, so you should all participate it. And while subscribing, you should use this invite code, that is Anshul B10. Okay, please use this invite code using Anshul B10, and please participate in such combat or such polls, because they will build your interest. Okay, so it is a very good thing, and you can also win scholarships and various awards. And also we have launched a special new feature called as raise your hand feature, with in which you can just digitally raise your hand and interact with your learners, that too live. Okay, in live classes we have launched this new feature, so it is a very interesting feature which helps to connect with your educators and also interact with your educators. Okay, so that you don't get bored, or it is not a one-way communication, you can participate in the class also. Okay, now as we have discussed, a QBank, approximately 25,000 plus MCQs are there. It is very good QBank. It covers every aspect, the clinical scenarios, the skygrams, the histopathological slides, the images, the various tests, the recent advances, okay, last year's questions or recall questions, everything it has. You don't need to solve questions from any other platform. A concise manner में you will have question practice of every type of question, so it is very good, and you should subscribe for this question bank wala subscription. And if you subscribe for this subscription, please use this code to get extra 10% off. Now we have also scheduled a grand test for the INICET, because as we all know, INICET for this year is scheduled on November 14th. Okay, so not much time is left, hardly 50 days are left. So for this we have scheduled a grand test, and it is on 26th September at 10 a.m. on the INICET, same INICET pattern. So please do attend, don't get afraid of giving grand test. And grand test देने के बाद analyze yourself, read the explanation of every question, whether it is right or wrong. Okay, so the analysis of the grand test and reading the explanation is very important. Okay, so please attend this grand test on 26th of this September. And for subscribing or giving the grand test on app, you just need to open the self study test series and the INICET grand test in the upcoming option, and on website in the test series you have the grand test in the upcoming option, so you can enroll and then participate in the grand test. Okay, now focusing on different sets of examinations, we have started a NEET PG 2022 batches from 29 September, and INICET rapid revision, sorry, a 1 month short duration package. Isme we'll focus on INICET and cover everything. We have started this from the 29 September Okay, so after 3 to 4 days we are starting this, so you can enroll for this. And for the FMG 21 2-month course, because it is scheduled in December, so we are going to start this batch on 29th of the September. And a very important and interesting batch of clinical examinations and procedure batch is also starting from 29th September. And it is a very important and must batch for everybody, because you can see for and you can correlate what the things you are studying theoretically. And एक बार वो चीज, if you see it with your eyes, or you can see it clinically, then you will understand the concept, and also you will not forget that thing. And very importantly, they will develop interest in that subject or the topic or towards your study, because theoretically padhta rehna sometimes it gets very boring. So it will develop your interest also. So very important batch for clinical examinations and procedures starting shortly. And we are running limited time period offers. The first one is, if you'll subscribe for any subscription package of 12 months, you will get 2 months of that subscription absolutely free, and 24 months or 2 years where the 4 months will be absolutely free. And also the iconic subscription pay, we are running a limited time period heavy discount. Like earlier, the 4 years was of 75,000, but now it is of just 65,250 for the entire 4 years. And you can use this code while subscribing to get extra 10% off. Okay, this is a various subscription plans, and as you can see, the cost per month decreases significantly if you increase your duration of the subscription. So economically भी ये फायदा होगा, and secondly your academics will be more better, because a trusted single source of information is very important from the starting of your preparation. So if you will study the same topic from different platforms, you are just confusing yourself, and it will be very cumbersome for you to revise. So have a single source, and an academy is the best for it. Okay, so please go for subscription packages with longer duration, and you can use this code while subscribing to get extra 10% off. Okay, so this was about a promotional activities. So let's start today's session about INICET. Let's crack INICET with an academy. Okay, so first question is, medial meniscus is more prone to injury because of. Okay, so after every question I'll give you 15 seconds, or the correct answer according to you. You can type in the live chat box, or you, if you have any doubt, you can also type in the live chat box. Okay, so here are your 15 seconds. Okay, so the answer for this question will be A, due to its fixity to the tibial collateral ligament. Okay, semicircular in shape होता है, yes, होता है. Okay, fibrous capsules attachment होता है. Okay, so but more prone is due to this. We have read कि medial menisci and medial collateral ligament, they are attached to each other, and दोनों की इंजरी जनरली साथ में होती है. And due to this medial menisci is less, medial menisci is very tense, so it is, there are high chances of injury. And इसके साथ में अगर ACL की भी इंजरी हो जाती है, तो they form the terrible triad of the knee, also called as the O'Donoghue triad. Okay, so very important, ये चीज आपको याद रखनी है कि medial malleolus and medial collateral ligaments are attached with each other. So that's why the injury of medial menisci is more common. Okay, here you can see the 6 ligaments: the medial collateral, the lateral collateral ligament, okay, the medial and the lateral menisci, and this anterior and the posterior cruciate ligaments. Okay, this was the answer. And now the next question is, injury to the popliteal artery in fracture lower end of the femur is often due to. Here are your 15 seconds. Okay, so the answer for this question is A, that is distal fragment pressing the artery. जो lower end of the femur or the distal end of the femur होता है उसमें as you know the normal course की in the popliteal fossa, the popliteal artery can be palpated, and there it divides into two of its branches. So posteriorly there are chances of injury to the popliteal artery. So distal fragment के due to the pressing of the distal fragment or displacement of the distal fragment posteriorly, there are chances of injury to the popliteal artery. Okay, so the right answer is A. Now next question is transverse fracture of patella. The treatment is, okay, here are your 15 seconds. Okay, so the answer for this question will be B, wire fixation. देखो patella जो होता है, the treatment of choice for patella depends on the fracture. If it is obviously undisplaced or two-part undisplaced fracture, then conservative treatment with the help of cylindrical cast. Okay, special cylindrical cast. Or if it is two-part or three-part and displaced, then the treatment of choice is your K-wire TBW, that is tension band wiring. It is the treatment of choice. But if there is very small बहुत सारे parts, okay, or a stellate type where it is unreducible, okay, then you can go for partial or complete patelectomy. बस ये ध्यान रखना है, आप कोई सी भी सर्जरी करो पटेला की, either tension band wiring or the patelectomy, the retinaculum or the extensor tendons have to be repaired because there is injury to this in fracture of patella. So the answer is wire fixation. Small fragment excision of patelectomy is not the answer because साफ it is mentioned कि it is a transverse fracture of patella. That's why the answer will be wire fixation, means K wire TBW tension band wiring. Now ये है simple सा question. अब इसी question को the examiner can extend into 6 to 7 lines by giving a history, then an x-ray. History can be this year old female, the history of trauma, यहाँ पे पेन स्वेलिंग है, ऐसा फ्रैक्चर है, ओके, नाउ व्हाट विल बी द ट्रीटमेंट ऑफ चॉइस एक्सेट्रा. सो बेसिक चीज आपको ये दो लाइनें ही है, एंड 6 to 7 lines इज जस्ट स्ट्रेचिंग ऑफ द क्वेश्चन. सो जस्ट रीड द क्वेश्चन केयरफुली and just identify the important things the examiner wants to tell you, or the important things that will lead to the answer, and it will be very easy for you. So the answer for this question is the wire fixation. Here you can see fracture of patella, and इसके साथ here you can see this is K wire TBW. टेंशन बैंड वायरिंग वर्क्स ऑन द प्रिंसिपल कि वायर का जो टेंशन होता है, दिस टेंसाइल फोर्स is converted into the compressive force so that the displaced fragments are compressed and in aligned to each other. Okay, this is fracture of patella. Now commonest dislocation of hip is, okay, here are your 15 seconds. So very easy question. The answer is B, posterior. Remember, most common joint to get dislocated is shoulder joint, and is shoulder joint may be most common is your anterior dislocation. Oh, okay, and in anterior maybe at subcoracoid position it is most common. Now next most common joint is hip, and usme bhi the posterior dislocation is most common due to the trauma. Okay, and this year's NEET PG 21 maybe there was one question about the posterior dislocation where a clinical scenario and the characteristic attitude of the lower limb of posterior dislocation was given, and the characteristic attitude of posterior dislocation is posterior dislocation. So if head is dislocated posteriorly, then the hip will be adducted, internally rotated and flexed, and there will be shortening of that limb. Okay, there will be shortening of that limb, and the treatment of choice is your closed reduction followed by maintenance in traction. Okay, by traction. So this is your posterior dislocation of hip. Okay, here you can see flexed internally and internally rotated and adducted with shortening of the limb. Okay, एंड इन एंटीरियर इसका उल्टा हो जाएगा. एंटीरियरली में द हिप विल बी एक्सटर्नली रोटेटेड, extended and abducted, and the knee, in typical case the knee is slightly flexed. Okay, the knee is slightly flexed. Okay, this is your posterior hip dislocation. Now next question is physiological interruption of transmission is, nerve की बात हो रही है यहाँ पे. So here are your 15 seconds. So the answer is neuropraxia. See, the neuronal injury में there is classification which is called as Seddon's classification, and Seddon's classification according to the type of injury in the neurons, it is divided into three types: neuropraxia, neuroatomasis and axonatomasis. So neuropraxia is a physiological interruption. Matlab there is no cut in the neural tube or even the axons, and spontaneously the deficit will be returned and the sensations will come back spontaneously, and it has a very good prognosis. And most of the nerve injuries in orthopedics, like in wrist drop or radial nerve injuries, in fracture of the humerus or supracondylar humerus में median nerve की injury, all these are most commonly neuropraxia only. Next is axonatomasis, where there is cut or injury to the axons but the main neural tube is intact. So here also there is spontaneous recovery, but it is very delayed, and in most of the cases it is not 100%. Now the most severe is the neuroatomasis, where there is cut or injury in the neural tube only. So spontaneous recovery is completely absent. Only and only surgery can be done, and the prognosis is very poor. Okay, अब इन तीन को ही पे ही there is another classification which is called as the Sunderland classification for the nerve injury, and in this type 1 is neuropraxia, type 2 is axonatomasis, and इसके दो और type हो गए 3 and 4, and type 5 is your neuroatomasis. Okay, neuroatomasis. So type 2 में क्या होगा, continuity of axons is lost, but the endoneurium, perineurium and epineurium are intact. In type 3 endoneurial injury, and in type 4 endoneurial and the perineurium will also get injured. Okay, so just remember दो नाम and Seddon's classification is most important. Okay, so this is about the nerve injury. Now next question is, identify the disorders shown in the picture. Here are your 15 seconds. Okay, so the answer for this question is your A, anterior shoulder dislocation. Okay, and this is an image of anterior shoulder dislocation. Here you can see the head of the humerus is displaced anteriorly in front of the glenoid cavity. Okay, it is the most common shoulder dislocation, and in chronic cases there is very important Bankert's and the Hill-Sachs lesion. जो Bankert lesion होता है, it is at the anterior inferior margin of the glenoid labrum, and Hill-Sachs is a depression on the posterior lateral margin of the humerus head. Okay, ये important है. And in any type of dislocation, the treatment of choice जो होता है, that is your closed reduction. Okay, and in closed reduction, in case of anterior dislocation, you have a formula called as T1 or TI, जिसमें first you give the traction, then you externally rotate, then you adduct, and then you internally rotate. Okay, this is the method of closed reduction of anterior dislocation of shoulder joint. Okay, in posterior dislocation mein you will have special sign. To first is your electric bulb sign. Okay, electric bulb sign, this is your electric bulb sign. Here you have the empty glenoid or the vacant glenoid sign, and there is widening of this glenohumeral space called as the rim sign. Okay, it is seen typically in the posterior dislocation, and posterior dislocation may you need to remember that it is most commonly due to, अगर history में electric shock और epilepsy और सीजर्स कन्वर्जन इस टाइप का कुछ भी दे रखा है, then the diagnosis favors towards the posterior dislocation. Okay, very important, remember this thing. Okay, now next question is, anterior tibial gliding on femur is prevented by. Here are your 15 seconds. Okay, so the answer for this question is your anterior cruciate ligament. Anterior cruciate ligament जो होता है anterior dislocation को prevent करता है, and posterior cruciate ligament the posterior dislocation of the knee joint and especially the tibia. Okay, now what is Humphrey and Wisberg ligament? Very important, you should know about these ligaments. So first of all, the ligament of Humphrey or Humphreys ligament is nothing but the anterior meniscofemoral ligament. Okay, anterior meniscofemoral ligament. So medial condyle of the femur से attached होता है, medial condyle of the femur से attached होता है. This is anterior meniscofemoral ligament between menisca and the femur. Femur will be medial condyle, and the posterior meniscofemoral ligament is called as the ligament of the Wisberg, and it is attached posterior to the PCL. So ये जो anterior and posterior meniscofemoral, it is in relation to the posterior cruciate ligament. तो posterior cruciate ligament के anteriorly होगा, so it will be anterior meniscofemoral or the Humphrey ligament, and इसके posteriorly will be your Wisberg ligament or ligament of the Wisberg. Okay, so remember this thing, it is also very important, the ligament of Humphrey and ligament of Wisberg. Okay, now next question, very commonly asked and very important question. Parathormone acts directly on which cells? Here are your 15 seconds. Okay, so the answer for this question is your osteoblast. Parathormone ka main function is increase in the serum calcium and decrease in the serum phosphate, and increase in the serum calcium is mainly due to increased resorption of the bone. Okay, and osteoclast का भी main function is increase resorption of the bone, but the parathormone does not directly act on the osteoclast. They act, or they have receptors on the osteoblast, through the formation of the rank and the rank ligand binds on the rank of the osteoclast, जिससे there is differentiation and activity of the osteoclast, increase activity, so there is resorption of the bone. So parathormone directly acts on the osteoblast and it leads to osteoclastogenesis. Okay, remember this thing very importantly. And इंक्रीज रिजॉर्प्शन ना हो, इसको चेक में रखने के लिए यू हैव अ competitive inhibitor of this rank ligand which is called as OPG, osteoprotogranin. Okay, you need to remember this also. Now next question. A child presented to an orthopedic clinic with a limp. The surgeon suspected him to have a fixed flexion deformity of the hip. Which test should the surgeon perform to confirm his finding? Okay, here are your 15 seconds. Okay, so the answer for this question is your A. Thomas test, which is used to diagnose the fixed flexion deformity or flexion deformity of the hip. Hip may you need to remember 3T. First is your Thomas test, second is your Trendelenburg test, and third is your telescopy. Okay. Now, Thomas test is test for flexion deformity of the hip. It is done like this, that in normal conditions, if you flex the hip and the knee, the opposite pelvis or the thigh will remain fixed to the bed or the trolley or the area on which the patient is lying. But if it is not in contact and there is upward displacement, it means opposite leg जो है there is flexion, so flexion के कारण proper flexion deformity है, so obviously to support the pelvis, the opposite pelvis gets raised. This is called as Thomas test. आपको सिर्फ इतना याद रखना है, flexion deformity के लिए होता है. And second is a Trendelenburg test. Trendelenburg test is very important और इसमें खास बात आपको ये ध्यान रखनी है, ग्लूटियस मसल्स में इंजरी की वजह से होता है, दैट टू मोस्ट कॉमनली ग्लूटियस मीडियस. And if this is your affected side, the pelvis will be tilted to the opposite side, but the body while walking will be tilted to the affected side, and the affected muscle will be also of this side. Okay, so this is important. This is called as Trendelenburg sign. Now what is Nilletton's line? Nilletton's line क्या होती है? Anterior superior iliac spine to ischial tuberosity नीचे. Okay, this is anterior superior iliac spine to ischial tuberosity तक. If you draw the line, it passes near to your greater trochanter. Okay, and if the greater trochanter is above this line, that means you have dislocation of the hip or the fracture of the neck of the femur. So Nilton's line is important. And telescoping, we all know ki you push the femur head like this while flexing the knee, and if there is dislocation, then the femur head will be felt as floating in the hip joint. Okay, and generally it is done in children. Okay, the telescopy test. Okay, so very important, you just need to remember कि किसके लिए होता है. Okay, now next question is, trigger finger involves which joint? Here are your 15 seconds. Okay, so the answer for this question will be metacarpophalangeal joints. Most commonly, and the first joint affected is the metacarpophalangeal joint, because इसमें क्या होता है, there is a pulley system here and the tendons are in a fibrous sheets. Okay, so due to sometimes in a person, due to trauma or anything, there is a nodule which develops in this fibrous sheet and it gets thickened, and there is a thick fibrous sheet जिसमें these tendons get entrapped, and sometimes the finger of the affected part will get locked like this. And in the initial stages, or if it is not that severe, you can unlock your finger by the manipulation, but in severe cases you cannot even unlock the finger and it is painful also. This is called trigger finger. Okay, so it is seen in the metacarpophalangeal joint. Okay, uh, sorry. So the next question is, aeroplane splint is used in. Here are your 15 seconds. Okay, so the answer for this question is C, that is your brachial plexus injury. Aeroplane splint is used in brachial plexus injury. Okay, here you can see this is your aeroplane splint used in the brachial plexus injury. This is your knuckle bender splint, and this is a dynamic kind of splint, and it is used for the ulnar nerve injury, Boston bracet for the scoliosis, cock-up splint for the radial nerve injury or the wrist drop. Remember the photos. And this is Milwaukee brace. It is also used for the scoliosis. Okay, sorry. So these are very important pictures. So जहाँ पे भी ऐसे पिक्चर्स आता है, you just take a screenshot of these pictures. Okay, and save it in your gallery, and whenever you get time, like 5 to 10 minutes भी अगर आप दिन में लगा निकाल के ऐसे 40-50 image, just if you see these 40-50 image, first of all you will never forget that image, and also it is the best way to revise, and कभी भी you will not face any problem in image based questions. Okay, so ये छोटी छोटी चीजें will help you a lot during your preparation. Okay, so do follow these tips मान लो, या my experiences, because I used to do such things. Okay, so very important for the image based questions. Now next question is, all of the following are true regarding application of POP cast except. Here are your 15 seconds. Okay, so इसमें examiner wants to know except all are true except means which one is wrong. Okay, so putting the plaster roll in warm water hastens setting time, yani it decreases the setting time. Yes, it is correct. It is anhydrous calcium phosphate. Let us put a question mark here. It should not be applied in presence of excess swelling. Yes, because excess swelling पहले ही है, compartment syndrome के chances पहले ही, and if you put a extra cast then it will just increase the pressure of the compartment. And fourth is gangrene is known complication of tight plaster cast. Yes, it means this is the wrong answer, wrong option, and so this option is the answer for this. That is, it is anhydrous calcium phosphate. It is basically not anhydrous. It is hemihydrous calcium sulfate. Okay, and hemihydrous calcium sulfate. Okay. So remember this, very important, cast लगाते time, especially in the closed fractures, because in closed fractures में compartment syndrome होने के chances रहते हैं, especially in the fractures of both bone forearm, the proximal tibia fracture or the distal tibia fracture. Here there are high chances of compartment syndrome. So compartment syndrome के जो basic preventive measures होते हैं उसमें ही loose cast, limb elevation. Okay, loose cast, limb elevation, no tight external bandages, etc. These are the main preventive measures of the compartment syndrome, so remember about this. Okay, now next question is, in uncemented arthroplasty of the hip, the stem remains attached to the bone, that is the femur, by, here are your 15 seconds. Okay, so the answer for this question is A, that is, in uncemented THR or total hip replacement, the stem is attached to the femur bone with the help of bone ingrowth or on growth over the surface of the stem. Actually क्या होता है, the stem is porous. Okay, and optimal porous size is 100 to 400 microns, and these porous surface helps to form a covering of a bone layer, either in the form of ingrowth or the on growth, and it helps to the fixation of the stem with the femur, because cement nahi hai, because cement nahi hai, so to fix this, the stem has pores in it. Okay, and this stem is created by this sintering or the diffusion bonding process. इतना काम का नहीं है आपके, just remember कि it is porous, and so the mechanism is bone ingrowth or on growth over the surface. ओके, मैकेनिकल बॉन्डिंग यस होती है, लेकिन वो इसकी वजह से ही होती है. प्रेस फिटिंग ऑफ द स्टेम इन द टाइट कैनाल, बट it is of no use because weight bearing and with time it will get loose. And adhesion between the stem and bone due to adhesive properties of the stem, so stem as such have no adhesive properties. Okay, so remember this thing about the total hip replacement. Okay, here you can see it is total hip replacement. Why? Because the femur head as well as the acetabulum are replaced, whereas in this is arthroplasty or total or complete arthroplasty. In hemiarthroplasty, only the femur head is replaced, and it is of two types: unipolar, एक ही पोल में या एक ही प्लेन में movement, and bipolar if the movement is in two planes. So this is arthroplasty or total hip replacement का X-ray. Okay, and here this is cemented one. Okay, ये क्या है? Cemented THR है, and here there is no cement, it is uncemented THR. Okay, this is your uncemented total hip replacement. Okay, now next question. Next question is, during performing a total hip replacement, the surgeon found destruction of the articular cartilage and multiple wedge-shaped subchondral depression. What is this called? Here are your 15 seconds. Okay, so the answer for this question, total hip replacement कर रहे हैं, there is articular cartilage यानी joint is involved and multiple wedge shaped subchondral depressions. All this points towards the diagnosis of avascular necrosis of the फीमर हेड और द हिप जॉइंट कॉल्ड एज एवियन, एंड इसी का ही दूसरा नाम है ऑस्टियोनेक्रोसिस. ओके, एवियन का ही दूसरा नाम और द अदर नेम इज ऑस्टियोनेक्रोसिस. सो द आंसर फॉर दिस क्वेश्चन इज ऑस्टियोनेक्रोसिस. ऑस्टियोमाइलाइटिस में तो यू विल हैव अ डिफरेंट picture of the x-ray. There you can see the sequestrum, okay, cloaca and the involucrum. Okay, so the answer is osteonecrosis. Now what is osteolysis? Osteolysis क्या होता है? In any bone, if there is prosthesis present, so periprosthetic region में क्या होता है? There is progressive destruction of that bony tissue. Okay, so in serial radiographs over months there will be osteolysis and radiolucent lines near to the prosthesis or the periprosthetic region, and this is called as osteolysis. Osteomyelitis, I have already told you, most common bacteria or the causative agent is your staphylococcus. Okay, here you can see this is your normal hip joint, and here you can see the collapsed femur head involving the joint space, osteoarthritis, and subchondral wedge-shaped deformities. Generally, it is more clearly seen in the MRI and in the initial stages of the avian. Okay, so the answer is avian. The dense wedge-shaped opacities. So ये start कहाँ से होती है? This starts from the anterior-lateral quadrant of the femur head, and then it involves the entire femur head, and this is called as the sectorial involvement. Okay, so sectorial involvement and anterior-lateral quadrant important है, याद रखना. Multiple cystic or subchondral cysts, sclerotic areas will be present. Okay, and if there is severe arthritis, acetabulum is also involved. This is your avian. Okay, now next question. Next question is match the column. Okay, so for this I'll give you 20 seconds. Here are your 20 seconds. Okay, so the answer for this question is D. How? Made Madelung's deformity is of the wrist. Okay, distal ulnar distal radius are involved, so it is wrist 2. Haglund deformity is of the calcaneum. Okay, 4. Buttonhole deformity, इसका दूसरा नाम is Bottonier's deformity, common in rheumatoid arthritis, and Gunstock deformity or the cubitus varus seen in the supracondylar fracture of the humerus, and most common complication of the supracondylar fracture of humerus, and it is a late complication due to the malunion. And अगर question आ जाता है most common early complication of supracondylar fracture of humerus is median nerve palsy. Okay, and it will be seen as the pointing index or the Ochsner's clasp index, like this. Okay, now what is made-lung deformity? Okay, made-lung deformity is a growth disturbance deformity at the growth plate, where क्या होता है, जो डिस्टल रेडियस होता है, ओके, एंड डिस्टल अल्ना, ओके, सो देयर इज abnormal growth in the distal ulna, especially in the volar side. Okay, here you can see, on the volar side or the anterior side there will be abnormal growth. Okay, this is your made lung deformity. Okay, डिस्टल रेडियो अल्ना, एंड इसके अलग नेम कौन से होते हैं ये याद रखने वाली चीज है, रेट्रोकैल्केनियल एक्सॉस्टोसिस, मल्होलैंड डिफॉर्मिटी और दी बम्प हम. Now, botaniers or buttonhole deformity is seen in rheumatoid arthritis when it involves the hand. Okay, and इसमें क्या होता है, there is flexion at the proximal or the middle interphalangeal joint and hyperextension of the distal interphalangeal joint. This is called as Bottonier's deformity. Okay, typically seen in rheumatoid arthritis. This is Haglund deformity or the Haglund lesion in the calcaneum. Okay, and it is seen like a calcanear spore, but it is at the site of insertion or attachment of the tendo Achilles or the Achilles tendon. So उसके अंदर जो intratendineal calcification होता है, it is Haglund's deformity, it is not calcaneal spur. ओके, क्योंकि कैल्केनियल स्पर अटैचमेंट साइट ऑफ टेंडो एक्लीज पर नहीं होता है. ओके, वेरी इंपॉर्टेंट, रिमेंबर दिस, Haglund's lesion. And cubitus varus, also called as the gunstock deformity or the bow elbow, seen in the malunion of supracondylar fracture of the humerus. Okay, very good question. देखो एक क्वेश्चन से वी हैव रिवाइज सो मैनी सुपर इम्पोर्टेंट थिंग्स, सो दैट्स एंड ऑल्सो इन इंटरेस्टिंग वे. ओके, और सिर्फ काम की चीजें अपन पढ़ रहे हैं, सुपर इम्पोर्टेंट, सो दैट्स व्हाई इट इज वेरी इंटरेस्टिंग एंड हाई यील्डिंग टू सॉल्व द MCQs. ओके, हियर इट इज cubitus varus and it is cubitus valgus. Okay, valgus में L आ रहा है, so lateral side में. And what is this angle? This is your carrying angle. Okay, so carrying angle is angle between long axis of humerus and long axis of ulna, and it is normally present in all individuals, because if you extend your elbow like this in supine position, here you can see your arm and forearm are not in a straight line. This is called as carrying angle. Okay, it is around 11 degrees in males and 14 degrees in females, and this carrying angle is increased in the valgus deformity and it is decreased in the varus deformity. Okay, very important, the carrying angle. Now next question, all are wrong about CTEV except. Okay, here are your 15 seconds. ओके, वेरी गुड क्वेश्चन. सबसे इम्पोर्टेंट है इस क्वेश्चन को ढंग से पढ़ना. ऑल आर रॉन्ग अबाउट CTEV एक्सेप्ट, यानी वी हैव टू आइडेंटिफाई द करेक्ट ऑप्शन amongst the following options. Okay, so foot is in adduction, yes it is correct. Equinus is corrected first. तो याद रखना अपन फॉलो करते हैं the Ponseti technique, and in Ponseti technique all deformities are not corrected simultaneously. Okay, and in that cavus followed by varus or adduction, and in the last equinus deformity is corrected, and in ये दोनों तो serial casting से correct करते हैं, and equinus deformity is corrected by a very minor surgical procedure called as stenotomy, where you cut the tendon of tendo Achilles, so the equinus नहीं रहता है. Okay, because this equinus or the plantar fraction is due to tendo Achilles. Okay, so this option is wrong. This is also wrong. CTEV is more common in females than in males. Wrong. In males this is more common. Foot is in adduction, yes it is correct. Okay, so the answer is that the foot is in adduction. So all are wrong except only this is correct. Okay, okay, now next question. Identify the instrument. It is a recall question from last year's INICET only. So here are your 15 seconds. Okay, so the answer for this question is ये देखो, the bone is fixed from external surface. Internally there is no implant. जो भी है it is outside the skin, external, so it is a type of external fixator. And among the options, इंट्रामेडिनरी नेल इज एन इंटरनल फिक्सेटर, ये भी नहीं हो सकता. इन दोनों में से बचा टेलर स्पेशल फ्रेम और द रेल फिक्सेटर. द आंसर इज द रेल फिक्सेटर. इट इज कॉल्ड एज द मोनो रेल फिक्सेटर or the railroad fixator, and it is generally used in compound cases or in cases of malunion, where this is called as the CD unit, and a distraction is done every day in a very systemic manner, like 1/4 turn is rotated in every 6 hours. Okay, so धीरे धीरे there is distraction, and the malunited segments are distracted, and they are aligned with each other. Okay, so this is called as railroad or the monorail fixator. Very important, just remember this image. Okay, now this is Taylor special frame. Okay, see this image, and this is your intramedullary nail or interlocking nail, femur. Okay, now next question. Which of the following casts or splints is used for fracture shaft humerus? Here are your 15 seconds. Okay, so the answer for this question is your A, that is hanging cast. Knuckle bender splint, it is used for the ulnar nerve palsy. Aeroplane splint for the brachial nerve, brachial plexus injury. Above elbow for both bone forearm or any fracture around elbow, supracondylar humerus, etc. Here it is used. Now in fracture shaft of humerus, most commonly the used cast is a U cast or the U slab, जो कि स्टार्ट होती है फ्रॉम द नेप ऑफ द नेक, covering the lateral side, then wounding or winding around the elbow covering the medial side. This is called U slab or the U cast. But if the fracture is in the distal 1/3, then you have a hanging cast. Hanging cast is just like above elbow cast, above elbow to here, but not covering the metacarpal ka head, only till the wrist. This is called as your hanging cast. Okay, this is called as your hanging cast. So this is your hanging cast used in fracture humerus, or typically in the fracture of distal 1/3 of the humerus. Okay, very important. And what is this? This is a below elbow cast. Below elbow cast, because it is below elbow, covering the all the metacarpal ka head. Okay. Now, next question is, in osteoporosis, alkaline phosphatase and calcium levels are. Here are your 15 seconds. This is also a recall question from previous year's AIMS examination. So, in osteoporosis, alkaline phosphatase and calcium levels are. Here are your 15 seconds. Okay, so the answer for this question is C, normal. Okay, because osteoporosis में mineralization is normal, calcium metabolism is normal, vitamin D level is normal, there is decreased in bone mass density. Okay, this is your osteoporosis. Remember about this. This is very very important. Where osteomalacia वगैरह जो होता है, in osteomalacia there is decrease in serum calcium, decrease in serum phosphate, because it is due to deficiency of vitamin D. Whereas in hyperparathyroidism में क्या होगा? There will be increase in serum calcium and decrease in serum phosphate. Okay, so but in osteoporosis it will be normal, and in osteomalacia and hyperparathyroidism दोनों में the alkaline phosphatase levels will be raised, and here it will be normal. So the answer for this question will be normal. Okay, now next question. Sequence of symptoms in compartment syndrome. It is recall of 2021 जो अभी हुआ था examination in July or August, I guess August में. So it is the recall question, and here are your 15 seconds. Okay, so the answer for this question is, सबसे पहले compartment syndrome. Compartment syndrome में the earliest and the typical symptom or feature is pain, and the late or the last feature is your pulselessness. Okay, and the last feature is your, sorry, paralysis. Yes, last feature is your paralysis. Okay, so this first there will be pain, and especially on the passive stretch. तो इसमें एक stretch test भी होता है, like most commonly in the upper limb forearm के अंदर होता है in closed fracture. So if you it is most common in the anterior of the flexor compartment. So if you passively like this extend the fingers, there is intense pain. In pain का एक बहुत पैथोग्नोमिक फीचर होता है कंपार्टमेंट सिंड्रोम में कि it is तो पैसिव स्ट्रेस टेस्ट पॉजिटिव एंड इट इज वेरी इंटेंस, आउट ऑफ प्रपोर्शन ऑफ द इंजरी. ओके, जितना पेन एक फ्रैक्चर में होता है उससे बहुत बहुत पेशेंट इज लिटरली इन एगनी एंड इन पेन. Okay, they just shout and cry. It is so much intense. So intense pain is the earliest and the characteristic feature, and the paralysis is the late feature. इसके बाद there is pallor, pulselessness, etc. Okay, so the sequence will be like this. In दो चीजों से you will get to know the sequence. And very important, remember that pulselessness or the pulse is not the typical feature or the diagnostic feature of the compartment syndrome, because even sometimes even the compartment syndrome if present, okay, then pulse can also be present, okay, and very often pulse is absent from the starting of the compartment syndrome, or even the compartment syndrome has not developed, because due to hypovolemic shock, etc., you may not able to feel pulse. Okay, so it is not a typical, or it this feature इस feature से आप कभी भी compartment syndrome का diagnosis मत बनाना. Okay, so remember this about compartment syndrome, very important. And इसमें important बात ये है कि it is a medical emergency, because you need to decrease the pressure of the compartment syndrome, otherwise there will be blockage of the vessels and the nerves, leading to the gangrenous changes and the paralysis of the muscles and injury to the nerves. Okay, and chronically they will form the contractures, and उससे भी ज़्यादा gangrene हो गया, so you will have to do the amputation of the limb. So treatment of choice, कोई भी पूछे आपसे compartment syndrome का, तो it is fasciotomy. Okay, so the treatment of choice of compartment syndrome is fasciotomy, remember. Okay, now compartment syndrome कैसे होता है? It is a vicious cycle due to tight cast or due to swelling and hematoma. क्या होता है? There is pressure on the in the compartment. Okay, so inflammatory cytokines etc are released that increase the permeability, जिससे और ज़्यादा pressure build up होता है. And also जितना ज्यादा प्रेशर बिल्डअप होगा उतना ही ज्यादा देयर विल बी वीनस स्ट्रेसेस, डिक्रीज वीनस रिटर्न, तो उससे और प्रेशर इंक्रीज होगा, विच विल लीड टू द कंप्रेशन ऑफ द इंपॉर्टेंट नर्व्स एंड वेसल्स. ओके, सो रिमेंबर कंपार्टमेंट सिंड्रोम वेरी इंपॉर्टेंट and a grave medical emergency. Every medical student or at least MBBS graduate should know how to identify the compartment syndrome and how to manage it. Okay, now next question is plaster for Cooley's fracture, the sequence is. So here are your 15 seconds. Okay, so the correct sequence will be, first of all, we will give the traction, then we will do the palmar flexion to disengage the distal and the proximal fractured segments. Then we will align them and we will reduce them by proper traction and manipulation after doing the palmar traction also, and you will fix them in ulnar deviation, and then you will apply the POP. So this is the correct sequence for the application of plaster in Cooley's fracture. ओके, 4 1 2 3. ओके, एंड ये जो करते हैं ये आप एक स्पेशल पोजीशन, दैट इज holding hands, okay, for giving the traction. Then you do the palmar flexion, then the ulnar deviation, and you apply the cast or the slab. In scaphoid fracture, you have, this is called as a Cooley's cast and scaphoid fracture. You have a special cast called as the glass holding cast or the scaphoid cast. It is like this in glass holding pattern, and इसमें क्या होता है, 5 मेटाकार्पल्स के हेड तो सब में ही होता है, इसमें इन ग्लास होल्डिंग कास्ट यू take this thumb entirely in the cast. Okay, first difference is this, and secondly it is not in the ulnar deviation, it is in the radial deviation. Traction, palmar flexion, then the radial deviation. Okay, so this is your scaphoid cast or the glass holding cast. Now, next question. In posterior femur displacement, next step of management is. Here are your 15 seconds. So we have already discussed कि किसी भी तरह के displacement और dislocation में the treatment of choice or the initial treatment is closed reduction under GA or block, then maintenance. तो posterior में भी you do the closed reduction, and the closed reduction की technique in posterior is Bigelow's technique and the Watson and Crick टेक्निक. ओके, ये दो टेक्निक का आपको याद रखना है. सॉरी, वॉटसन एंड जेम्स टेक्निक. नाउ नेक्स्ट क्वेश्चन. इन ओपन फ्रैक्चर इनकरेक्ट स्टेटमेंट इज. हियर आर योर 15 seconds. Okay, so the answer for this question is incorrect statement we need to identify. So first of all, tibial fractures are commonest. Yes, that's why if you remember कि ये commonest क्यों होते हैं, because if you feel your shin or at the leg, you can very easily feel the anterior border or shin of the tibia. So ये इतनी subcutaneous bone होती है कि यहाँ पे tibial fractures are more common, most common, and ऐसा भी बोल सकते हैं कि mostly the tibial fractures are open fractures. Okay, due to the subcutaneous nature of the bone. Multiple fractures are not common. This is wrong. Multiple fractures are very common. Compartment syndrome is rare. Yes, बिकॉज ओपन है कंपार्टमेंट, पहले से ही ओपन है, तो जो प्रेशर होगा वो वैसे ही रिलीज हो जाएगा. सो यस, कंपार्टमेंट सिंड्रोम इज रेयर. immediate debridement should be done. Yes, this is also correct कि as soon as possible the contaminated or the dirty wound should be debrided. So the correct answer for this question will be second. Okay, the correct option answer will be the second. Now कोई भी open fracture होता है, so the open fracture में what is the treatment protocol that you follow, and it is very difficult to manage. So first of all you have to check the vessel and nerves. अगर vessel and nerves intact है, then what you do, first of all you debride and you fix the bone, generally by the external fixator. Internally by nail or plate you cannot fix because it will lead to infection of the orthopedic implant, and that will be very serious condition for the patient. So debridement with fixation of the bone, then you do the wound care by proper antibiotics and proper dressings. You are now the granulation tissue to set in and transfer the patient to the plastic surgeon, where the patient undergoes plastic surgery and there is flap or graft at the wound site so that it is converted into a closed fracture. ओके, बट मोस्ट ऑफनली एक्सटर्नल फिक्सेटर का जो होता है, इट इज टू फिक्स द बोन इन अलाइनमेंट. सो मोस्ट ऑफनली द बोन आर माल यूनाइटेड और non-union. So for this, it is again the patient goes to the orthopedician, and there you do the deformity correction, most commonly by the Ilizaro or the monorail, etc., and then the union. And in all these, physiotherapy is very important. So it is such a long procedure to manage the open fracture. Okay, so अगर vessel या nerve injury भी है तो there is a proper sequence कि ऐसे ऐसे you fix it. So if there is any neurovascular injury with fracture, so first of all you will fix the bone, then the extensor tendons, then the flexor tendons, then you will fix the artery, then the nerve, और आर्टरी के साथ में जनरली वेन इज ऑल्सो फिक्स्ड. एंड अगर वेन अलग से पूछे तो लास्ट में वेन. ओके, बंडल पूरा एक साथ ही हो जाता है, आर्टरी, नर्व एंड वेन. नाउ next question is Paget's disease most oftenly strikes which age group? Here are your 15 seconds. Okay, so the correct answer for this question is D, that is adults over 40. Remember, 30 to 50 ईयर्स ऑफ द एज ग्रुप में दो ही मेटाबॉलिक डिजीजेस कॉमन होती है, और इन मेटाबॉलिक डिजीजेस का मोस्ट कॉमन एज ग्रुप भी यही है. फर्स्ट इज द पेजेट्स डिजीज एंड सेकंड इज योर हाइपर पैराथायरॉयडिज्म. ओके, सो पेजेट्स डिजीज क्या होती है? बेसिकली अ डिजीज related to the osteoclast, deformed functions of the osteoclast where there is lytic lesions, है ना, with superimposed sclerosis. Okay, so Paget's disease is a mixed kind of disease. Okay, so adults over 40 years में it is most common. Paget's disease most common कौन सी bone को affect करती है? That is tibia. Remember this. Okay, so Paget's disease is seen in adults over 40 years, 30 to 50 years age group wale. Now next question. Most common sequelae of tuberculous spondylitis in an adolescent is? Here are your 15 seconds. Very important question. This is a very important question. Okay, so the answer for this question is B, that is ankylosis, that to bony ankylosis. TB spine ka characteristic sequelae is your bony ankylosis. Okay, remember this. Okay, dislocation, fracture, ये सब तो होता रहता है, but adolescent में the most common is your bony ankylosis. That means the joint will get fused with each other and it will look as a bone. Okay, there will be osteogenesis there, abnormal bone formation or calcification, bony ankylosis. Next question. Tuberculosis of the spine commonly affects all of the following parts of the vertebra except. Here are your 15 seconds. Okay, so the correct answer for this question will be, the correct option for this question will be your C, that is spinous process Y. ये ध्यान रखना, tuberculosis और port spine में the anterior part of the spine is affected. यहीं पे there is formation of gibbus etc. Okay, so anterior part is affected. So body, lamina and pedicle, इन सब में से द मोस्ट पोस्टीरियर पार्ट इज अ स्पाइनस प्रोसेस. स्पाइनस प्रोसेस तो पोस्टीरियर मोस्ट ही होता है पार्ट स्पाइन का. सो दैट्स व्हाई द आंसर इज द spinous process. Okay, that's why the answer is the spinous process. It is the most posterior part of the spine. So ये ध्यान रखना है आपको कि tuberculosis involves the anterior part and उससे it shifts towards the posterior part. Now next question. Ulnar nerve paralysis will cause. Here are your 15 seconds. Okay, तो सबसे पहले ape thumb deformity, it is due to median nerve. Wrist drop is due to radial nerve. Claw finger is due to ulnar nerve. Myalgia paresthetica, ये तो lower limb में हो जाता है. So the answer is C, that is claw finger. Okay, now claw जो होता है, it is of two types. First is partial and second is complete. So जो partial claw hand होता है, इसमें only and only the ulnar nerve is involved. So that's why there is flexion deformity or clawing of the fifth and the fourth finger. Okay, whereas in complete, ulnar plus median nerve palsy is there, so the entire thing is clawed. So this is your complete claw hand. अब ये जो दे रखा है, it is not a claw hand. What is this? This is Benedict hand or hand of benediction. Okay, and it is seen in case of median nerve injury. Okay, कैसे पता लगा है? Because there will be, you will be unable to flex the index and the ring finger, which is supplied by the median nerve. Okay, so important is claw hand. Now this is a question of recall, NEET PG 21 only. Okay, test shown below is used in testing which nerve? Here are your 15 seconds. This is not medial, it is median. Okay, so the answer for this question will be your ulnar nerve. This is pen test. Okay, okay, used to test the adduction of the thumb. और thumb adductor इसको टेस्ट करने के लिए बोलते हैं. Normally if you put a pen like this, the thumb will be able to touch the pen. This is called as पेन टेस्ट. ओके, अल्नर नर्व. और कौन कौन से टेस्ट होते हैं अल्नर नर्व में? अल्नर नर्व में और एक टेस्ट होता है द फ्रोमेंट साइन. ओके, व्हाट इज फ्रोमेंट साइन? इन दिस, if you hold a book like this, generally you will be able to hold the book without flexion at your interphalangeal joint of the thumb. But if there is ulnar nerve palsy, then the thumb will be flexed. And also to test the interosseous muscles, you have a card test. Okay, you need to remember PAD, that is palmar interossei does the adduction. Okay, so to test the palmar interossei, you put a card and you try to hold the card. Normally I will be able to hold the card if my ulnar nerve is functioning, because the palmar interossei muscles will be functioning. Okay, so this is for the ulnar nerve. Okay, median nerve के लिए you have the Osner's index or the pointing index for the median nerve. Next is most common muscle affected in rotator cuff group is. Here are your 15 seconds. So first of all, इसके लिए you need to remember the rotator cuff muscles. And rotator cuff muscles को याद रखने का बहुत अच्छा तरीका है. आपको एक मसल याद रखनी है, that is supraspinatus. Supraspinatus है तो infraspinatus भी होगा. And there is one SS, so there will be another SS, that is subscapularis. And S के बाद T आता है, तो there is one muscle teres minor. Okay, remember these four muscles. These are very important muscles, rotator cuff muscles. And where is the insertion or attachment of these rotator cuff muscles on the humerus? They are attached at the greater tuberosity of the humerus. Okay, very important. Now supraspinatus muscle है rotator cuff की, infraspinatus भी है, teres major नहीं है, scapularis भी नहीं है, subscapularis है. Now इन दोनों में से overall also and in दोनों में से भी the most common muscle affected in the rotator cuff group is your supraspinatus muscle. And supraspinatus muscle जो होती है, if it is affected, it will lead to supraspinatus syndrome or the impingement syndrome. Okay, also called as the painful arc syndrome, and also called as the subacromial bursitis. So due to impingement of this subacromial bursa, and in painful arc syndrome क्यों बोलते हैं, because there is pain in shoulder abduction, and that too in the mid abduction. Okay, mid abduction after 50 degrees, between 50 to 100 degrees there is pain. So if there is mid abduction pain, it is called as the painful arc syndrome. So remember कि shoulder joint में abduction, adduction, extension, flexion, you need to remember. See, this is your abduction, adduction. This is your abduction, adduction. It is in which plane? It is in the frontal or the coronal plane, whereas this is your extension flexion. This is your extension flexion. So it is in your sagittal plane. अब abduction इसमें सबसे important होता है, because first 90 degrees of the abduction, the first 15 degrees of the abduction is by the supraspinatus, 15 to 90 degrees is by the deltoid, and deltoid में भी कौन से, middle fibers, not the medial fibers, middle fibers. And more than 90 degree or the overhead abduction is by the serratus anterior muscle. Okay, by the serratus anterior muscle. So remember this. So rotator cuff muscles की क्या functions होते हैं? The rotator cuff muscles, supraspinatus, which is the major muscle, it elevates the shoulder and elevates the shoulder laterally. Okay, infraspinatus will externally rotate. Okay, it has the function of external rotation. The subscapularis allows the free movement of the humerus, and the teres minor will also do the external rotation of the shoulder joint. Okay, so these are the functions of the rotator cuff muscles, very important. Okay, एक चीज होती है that is called as the rotator interval. Okay, so what is rotator interval? Rotator interval is generally used as a landmark during surgery, and it is a area between supraspinatus एंड सब स्कैपुलरिस. ओके, ये आपको याद रखना है, सुप्रास्पाइनेटस एंड सब स्कैपुलरिस के बीच में. नाउ नेक्स्ट क्वेश्चन, vascular sign of Neerath is seen in dislocation of. Here are your 15 seconds. Okay, so the answer for this question is hip. Especially in the posterior hip dislocation, you have a sign which is called as vascular sign of Neerath, or Neerath sign is positive. अब ये क्या होता है? Actually, you feel the femoral pulse of the bilateral limb. Okay, and generally by palpating the femoral pulse, you can palpate them easily. Okay, and that too bilaterally. So in supine position, you palpate for the volume, intensity and the position, and normally they are palpable bilaterally. But in case of any injury at the hip joint, neck of femur or the dislocation, वो नॉर्मल पोजीशन पे नहीं होगा, एंड ऑल्सो it will be very difficult to palpate, or sometimes you will not be able to palpate the femoral artery, because generally femoral artery is over a bony support. That's why you can feel it very easily, but you will not be able to feel it in case of hip dislocation. Okay, so positive test जो होता है इसमें, if the femoral pulses are not palpable, it is hip dislocation, and if they are feeble, then it points towards the fracture of neck of femur. This is called as sign of Neerath or vascular sign of Neerath. Okay, it is important. Just remember ki in dislocation of the hip, you will not be able to feel the femoral pulses because the bony support is lost. Okay, this is called as vascular sign of Neerath. Now next question is, avian of femoral head is most common in. Here are your 15 seconds. Okay, so avian is most common. Avian basically कहाँ कहाँ पर होता है बॉडी में? फ्रैक्चर नेक ऑफ फीमर मोस्ट कॉमन, फ्रैक्चर ऑफ स्केफॉइड एंड फ्रैक्चर ऑफ टैलस. ओके, एंड नेक ऑफ फीमर में भी इंट्रा कैप्सुलर क्या होता है? द इंट्रा कैप्सुलर फ्रैक्चर ऑफ नेक ऑफ फीमर इज कॉल्ड एज द नेक ऑफ फीमर proper, and the extracapsular fracture is called as fracture of intertrochanteric femur or the IT femur. और इन दोनों में differentiation is very important. Fracture neck of femur and fracture IT femur. Okay, so the answer जो होगा इसका होगा A, that is intracapsular femur neck fracture. First of all, neck of femur fracture is intracapsular, that is it is the IT femur is extracapsular. It is inside the capsule, so obviously there will be minimal displacement, so the displacement is very less or minimal, and it is more common in IT femur. Signs and symptoms are less, they are more intense in the IT femur. दोनों का ही age group is the ओल्ड और एल्डरली पॉपुलेशन. नाउ एक और इम्पॉर्टेंट बात, आईटी फीमर फ्रैक्चर will never go into non-union. Okay, non-union kabhi nahi hoga, they always unite. Whereas neck of femur fracture mein, if it is displaced, okay, if it is displaced, it never unite. Okay, so the treatment of choice for neck of femur is your surgery, and it depends on the age group. Okay, if the it is young adult, then you go for the CC screw or the corticocancellar screw or the DHS. And if the it is elderly, then you have to go for the hemiarthroplasty or the bipolar. Okay, or the bipolar. Neck of femur में three classifications है. First is based on the anatomical side, okay, whether it is subcapital or basicervical or transcervical. Second is based on the Powell's angle, so it is called as Powell's classification. And the third is based on the rotational thing, okay, called as the garden classification. And इसमें garden classification type 1 जो होता है, that is your impacted वाला, only that can be managed conservatively. Okay, so this is your neck of femur and IT femur. Very important, neck of femur is intracapsular. Okay, here you can see the fracture here, neck of femur fracture. Now, non-traumatic amputation seen in, here are your 15 seconds. Okay, so non-traumatic amputation is seen in leprosy, yes, diabetes, yes, in sickle cell anemia due to formation of thrombus, etc. So the answer will be all of the above. Okay, so the answer will be all of the above. Next question is, Tom Smith's septic arthritis is, it is asked in the previous INICET examination. Here are your 15 seconds. So the answer for this question is septic arthritis of infancy. Septic arthritis of infancy is called as Tom Smith arthritis. Okay, and generally it is seen in the hip. Acute onset होता है, रैपिड एब्सेस फॉर्मेशन होके बोन को पियर्स करके सॉफ्ट टिश्यू एंड स्किन को भी पियर्स करके इट इज में बर्स्ट आउट स्पॉन्टेनियसली, और जैसे ही आप इंसिजन लगाओगे बहुत ज्यादा पस विल कम आउट. टेलीस्कोपी टेस्ट विल बी पॉजिटिव. Okay, there will be dislocation of the hip joint, and there will be erosion of the hip joint and the femur head. Okay, and long term permanent problem हो जाती है in that hip joint, because the physis, the growth plate, all are destructed, and it resembles a condition which is called as congenital dislocation of the hip. Here you can see this is the affected part, okay, of the septic arthritis of the hip in infancy, called as the Tom Smith arthritis. And इसमें treatment क्या होगा? Urgent incision and drainage in all the directions, in all the planes जहाँ जहाँ पे भी पस है. And if there is dead tissue, you need to do the sequestrectomy and start the antibiotics according to the culture reports which you have sent after taking the pus sensitivity culture at the time of doing the surgery. And after that, you correct the deformity if any by osteotomies or graft or etc. Okay, so this is your treatment of choice in septic arthritis. Now next question, vascular repair to be done in which Gustilo Anderson type? Here I have 15 seconds. Okay, so vascular repair, सबसे पहले Gustilo Anderson type is for the open injuries. It is divided into three types. If the wound is clean and less than 2 centimeter, more than 2 centimeter, wound is dirty but there is no bone exposing. अगर बहुत ही गंदा lacerated wound है और it is bone exposing, or it is having neurovascular injury, then it is type 3, and type 3 में भी A, B and C होता है, and type C, that is 3C, is the type where there is neurovascular injury. So vascular repair will be required in type 3C. Okay, so type 1 जो होता है, there will be small clean puncture wound less than 2 centimeter, more than 1 it is 2. So more than 2 centimeter in type 3 there is large laceration and इसमें flap या फिर grafting की ज़रूरत होती है. Okay, there will be extensive soft tissue injury with bone exposing. Okay, and in type 3 neurovascular injury. Now next question. A 10-year-old boy presented with a mid-tibial swelling. On X-ray, lytic lesion with sclerotic margins was seen. What is the most likely diagnosis? Here are your 15 seconds. Okay, so the answer for this question is osteoid osteoma. सबसे पहले 10 ईयर है, लोअर लिम्ब में है, लाइटिक लीजन विद स्क्लेरोटिक मार्जिन, fibrous cortical defect नहीं होगा. Osteosarcoma में you will have sundry appearance, extensive periosteal reaction. Okay, so it is not the answer. Fibrous dysplasia, no, it will not be seen as a lytic lesion with sclerotic margin. So the answer is osteoid osteoma. Here you can see lytic lesion with sclerotic margin. It is osteoid osteoma. It is a benign lesion, benign bone tumor. Now for next question, 40-year-old female presents with multiple lytic lesions, fracture of clavicle and periosteal resorption of the second third metatarsals. What is the most likely diagnosis? Here are your 15 seconds. Okay, so the answer for this question will be B, hyperparathyroidism, because there will be increased bone resorption. So there will be lytic lesions, especially in the metatarsals and the metacarpals. Okay, and pathological fractures. Hyperthyroidism में no, renal osteodystrophy में भी ऐसा नहीं होता है. In osteomalacia also, there is no multiple lytic lesions in osteomalacia. Okay, so the answer is your hyperparathyroidism. Okay, and in hyperparathyroidism एक characteristic फीचर होता है इसका, दैट इज ओस्टाइटिस फाइब्रोसा सिस्टिका. ओके, एंड जो अभी मैंने ये जो बताया द लाइटिक लीजन स्पेशली इन द डिजिट्स with irregular outline due to subperiosteal resorption, this is called as the ostitis fibrosa cystica, and it is a characteristic feature of hyperparathyroidism. Here you can see characteristic feature of hyperparathyroidism. This is rugged jersey spine seen in hyperparathyroidism. Now next question. A child is pinned around by holding his hand by his father. While doing this, the child started crying and does not allow his father to touch his elbow. The diagnosis is, here are your 15 seconds. Very easy question, and the answer for this question is A, that is pulled elbow. Okay, and history say you can understand it ki yes, easily it is called pulled elbow in child and it is also called as the nursemaid's elbow, and it is due to dislocation of the annular ligament or the radial head inside the annular ligament, and this annular ligament is lax in children, it will lead to the dislocation called as pulled elbow. And इसमें आपको कुछ भी नहीं करना है, you just need to supinate, and while giving the traction you need to just by pressing the radial head, you need to flex the elbow and you will hear a click sound, and you can see the facial expressions of the child, that the child will stop crying and the anxious look will go away. This is your pulled elbow. Okay, this is your pulled elbow. Now next question is, what is the most likely cause of the abnormality seen in the wrist x-ray as shown below? Here are your 15 seconds. ओके, सो सबसे पहले इट इज एन एक्सरे ऑफ अ चाइल्ड. ओके, सो ऑस्टियोपोरोसिस हो नहीं सकता, पोलीज फ्रैक्चर, स्कैफॉइड फ्रैक्चर नहीं है, तो रिकेट्स. सो ऑप्शंस आर वेरी इजी, बट इसमें यू कैन सी द मेटाफाइजियल फ्रेइंग. Okay, in rickets is due to deficiency in vitamin D3, so the growth plate abnormality होगी, and there is excessive organic tissue or the collagen or the matrix. Okay, so there will be fraying of the metaphysis or the cupping of the metaphysis, and there will be widening of this epiphyseal line. Okay, so this is typical feature of rickets. Okay, this is typical feature of rickets. There will be bowing in rickets. Now next question. A boy presented with pain in his right hip. A pelvic x-ray was taken and is shown below. What is the most likely diagnosis? Here are your 15 seconds. Okay, so osteoporosis, no, because in osteoporosis there will be decrease in the whitish nature of the bone. Okay, the bones will be weak. Okay, more black, जबकि यहाँ पे it is more white. Osteopetrosis, also called as the marble bones. Okay, also called as the marble bone disease, जिसमें पूरा white हो जाता है. And here you can see there is sclerosis due to osteosclerosis. Okay, so here you can see the marble bone, like yes, it is osteogenesis imperfecta nahi hai, because in that uh, the you will have this type of image in osteogenesis imperfecta. Okay, weak bowing image, brittle bone disease बोलते हैं इसको. Okay, this is osteogenesis imperfecta. And osteopoikilocytosis में क्या होगा, it is also a sclerosing disease which is a dysplasia. And यहाँ पे क्या होगा, this sclerosis is in the form of these spicules. Okay, so there is multiple endostosis. Okay, so it is osteopoikilocytosis. So the answer is your osteopetrosis, also called as the marble bone disease. Okay, and it is due to sclerosis and thickening of the bone. And the defect जो होता है इसमें, it is failed bone resorption due to defect in the osteoclast production and the function. तो osteoclast से related ये disorder होता है, ये याद रखना, called as the marble bones or the Albers-Schonberg disease. Okay, this is a typical radiograph. See increased bone density and the thickness in osteopetrosis. Okay, now next question. Next question is, the following x-ray was taken of a 16 years old patient Which is the most likely pathology seen? Here are your 15 seconds. Okay, so Ewing sarcoma nahi hoga, because in Ewing sarcoma there will be periosteal reaction in onion peel regular femur with a lytic lesion. Okay, it is not seen no periosteal reaction like in the sarcoma. Osteosarcoma, in that there will be sundry appearance, intense irregular periosteal reaction in the soft tissues, no. Osteomyelitis, yes, not acute, because in acute osteomyelitis you will have not these features of the chronic osteomyelitis. Here you can see these. These is your sequestrum. This is your cloaca, the sinus, and new bone formation is the involucrum. Okay, so this is a typical X-ray of the chronic osteomyelitis. Okay, Ewing sarcoma ऐसा दिखेगा. It is your osteosarcoma or the osteogenic sarcoma. And the last, here you can see chronic osteomyelitis following a open or compound fracture. Okay, this is your acute osteomyelitis. So this was all about the INICET इस बार के MCQs. I hope you liked the lecture, and we had 100% strike rate in this year's NEET PG in orthopedics. All the questions were from my special class or YouTube class, the rapid revision courses, the MCQs. As it is MCQs, we have solved. So you can trust us, okay, and you can subscribe for our NEET PG courses. I have a special class on Wednesday, that is 29th at 9 p.m. on again a INICET focused class, where we'll see various clinical scenarios of the orthopedics important for the INICET and the clinical based questions. So please do attend the extra special class. For this you just need to download the mobile application and log in using this code, both of which are absolutely free. Okay, so I hope you like the video. If you like the video, please like, share and subscribe. You can comment in the live text box, chat box, so that if you have any doubts or queries regarding orthopedics and any strategic help you need for your preparation, and you can use this code while subscribing on Unacademy to get extra 10% off. For those whose focus in your is your November 14 INICET examination, or those who are not confident about the